Hello, my name is Jan Dewing and I'm Professor of Person-Centred Research and Practice Development here at the England Centre for Practice Development at Canterbury, Christchurch, and I also work jointly with East Sussex Healthcare NHS Trust. Today I've been asked to talk to you about person-centred practice in nursing and midwifery to help you as part of this module. And I think that's a bit of an audacious thing to do because I've been exploring person-centredness for about 15 years and what I'm going to aim to do here is to offer some broad-based remarks within the next 15 minutes or under. So you might want to set your watches and time me, but here goes. The first set of remarks I want to make are about the origins of person-centredness, and it's important that you understand that the way that you will currently experience, read about and see in practice person-centredness comes from a set of other ideas and a set of developments that have taken place over the last 20 to 30 years. Fundamental to that was the move away from what we called task or routine or even ritualistic nursing practice to individualised and more holistic practice, where we stopped thinking about nursing work as a series of separate and often unrelated tasks, and we started to think about the patient who was the object, the creature to whom we were doing these things to. And in fact we moved away from a doing to a working with or being with approach to work. So person-centredness is underpinned by some of the values and beliefs within patient-centredness. However, it's really important to be clear that patient-centredness and person-centredness, although related, are very different. And you need to be aware that sometimes these terms are used interchangeably, which in my view is inaccurate and unhelpful. One of the ways in which you can start to reflect more critically and examine in more detail person-centredness is to start thinking about values and beliefs. To begin with, I would really encourage you to explore your own values and beliefs. What is it that you believe and think is important or matters about care, about person-centredness? This is important because values and beliefs underpin virtually everything that we do and the way that we are in the way we work in practice. For example, it will influence our language, it will influence our thoughts, it will influence the way we think about what we should be doing, how we think about the way that people receiving our care respond, how far we're prepared to go, whether we think that extra mile is the right thing to do or not. It will also influence how we feel about people, families, relatives, when they respond in ways that we might find challenging or difficult. So begin by having a look at your own values and beliefs. In the narrated presentation that accompanies this talk, there's an activity that will help you do that if you're interested in exploring that further. The next set of remarks I want to make are about what people want from us. A lot of the time while we're preparing to be a nurse or midwife, we're really absorbing a lot of information about disease processes, conditions, about broader issues to do with nursing, healthcare, the NHS, and all sorts of social, political, cultural issues that are really, really important. And in practice, we're often concerned with practicing our skills and techniques and applying things so that we feel more confident. However, we need to take a pause and we really need to think about what is it that people want from us. Now, people do want the best person to deliver care at the best point and in the right place. But we also know that what people want from us is to be caring and compassionate. It matters not just what we do, but how we do it. And that's connected with the underpinning value of not doing things to or on people, but that we're with people, and our central concern is about the person, what they understand about what we're doing, how they feel about it, and the meaning that intervention and that conversation has for them with where they are in their life at that moment. So Make time, whatever subject, whatever topic you're exploring, to find out what it is that patients, people, user groups want from nurses and midwives. Current values, or rather current views I meant to say, sorry, current views on person-centredness are quite wide-ranging at the moment, and there's a variety of terms and discussions that crop up that you may come across. You'll still see patient-centredness used quite a lot. You'll hear terms such as relationship-centred care, women-centred care, family-centred care, and some other terms as well. For me, all of these are different ways, are diverse variations of talking about person-centredness, are ways of trying to help us remember that what we need to see first is the person, and the condition and the treatment and the interventions come after that, and not the other way around. Probably one of the things that you'll come across soon, if not already, is something called compassionate care, and this has been driven from a policy perspective, particularly from the Chief Nurse of England. Again, for me, compassionate care is another way of looking at person-centredness. But it's worth taking a look at the compassionate care model, because it sets out some 6 core components of what we need to begin our journey towards person-centredness. When you've mastered that, or if you feel you want something a little bit more challenging, I would really invite you and encourage you to look at a more complex model. Now, why do we need a more complex model? Well, my argument for that is person-centred practice is exactly that. It's not about just what you do with one patient or one person at one moment in time. It's about a whole culture, that in order to be effective in those moments of care, in those moments of work with people, surrounding the individual practitioners such as yourselves, there needs to be various things in place, and this is what we call a culture. It needs to be things like the right values and beliefs, the right language. It needs to be staff who are prepared appropriately, the right skill mix, the leadership, the way that the team works and communicates, the way that people talk about plan care, plan discharge, the way that the team feels about risk-taking, the degree of quality within the service and scope for innovation and for doing things differently. If we're practicing in person-centred ways, we really need to look at sometimes bending the rules, but doing that in a calculated way with the rest of the team. Otherwise, we make people fit into the system, which is not person-centredness. So, I would encourage you to explore some work in or on a person-centred practice framework by Brendan McCormack and Tanya McCants, and there is a book on this which was published in 2010, and you might like to have a look at their model, because it sets out these kind of core areas that I'm remarking on: the individual qualities of nurses as persons themselves, the settings in which they work, the culture, the actual practices and the way that we go about, how we go about doing things, and then what the impact and the outcomes might be for people who receive this care. Now, that's a kind of a way in which you can explore things more theoretically. I just want to offer you some activities or some pointers for how you can start to notice things about person-centredness, particularly when you're in practice. One of the first things that you can do is to look at language, your language and the language that's around you. How are people talking about people receiving care? For example, is it, that difficult patient in the side room? Is it the stroke in bed 6? Is it the family? I'm always wary when we put a "the" in front of someone or a group of people, like the elderly, the hard to reach. Labelling often reveals how we think and feel about people, so it always still surprises me how often we hear people referred to as diabetics rather than the person who's living with diabetes. How often people with dementia are referred to as demented or mad or as nutters or a whole other of unacceptable terminologies. So have a look when you're in practice and have a look for language that you think is person-centredness. So remember to look for the positives, because then you can learn to use those. But look out for things that are maybe bad habits or things that people aren't aware of, and make sure that you don't copy or inadvertently fall into following those sorts of standards. So the way that we talk to people is really, really important. The other activity that you can look at is the way that interventions are carried out. So when you're working with somebody, is the focus on the task, getting the job done? And that goes back to what I was saying about doing things on or to people. Or is it about negotiating, discussing care with people and carrying out an intervention with them with a view that the person understands what's happening to them and is involved in evaluating its outcomes? I guess the mantra that's around that really sort of covers this is nothing about me without me. So I'd really encourage you to look out for the difference, even in small interventions, to see that they're being done in person-centred ways. A really interesting way to look at how person-centred a workplace is or a team are is to look at how they respond to compliments. Are compliments valued? Are they really appreciated? Or is it just another thank you card or another box of biscuits or chocolates? Or do people really remember and appreciate why they're being thanked? And of course the opposite of that is, how do teams respond to complaints, whether they're small or large, informal or formal? Are these seen as coming from difficult people, or are they seen as an opportunity to learn? Teams where there's a person-centred culture value getting feedback, and they value involving patients. So as well as looking at comments, compliments and complaints, how are the teams and the practitioners that you're working with involving patients, families, relatives in planning care, in evaluating care? Do we really value patient, women's, service users' experiences, and are these used to really encourage learning? A final point: when you engage in learning experiences in the workplace, what sort of learning is it? Is it organised around conditions, diseases? So for example, a session on stroke care, a session on diabetes, a session on dementia, a session on abnormalities of pregnancy or the final stage of labour? Or are sessions organised around people, around persons? So caring for persons with diabetes, helping persons with... So have a look out for that. And when you're studying, when you're, cramming all that educational material into your head, always keep in mind that this isn't just about learning the facts, about learning the conditions. It's about how you are going to apply that knowledge with people and how you are going to help those people understand what that knowledge is about, what that final comment is just to remind you that there will be a narrated PowerPoint that you can follow up, and I hope I've made you curious about wanting to learn more. There are other resources on YouTube and other such websites where you can follow up and hear other people talk about person-centredness and person-centred practice. And I would encourage you to tweet and follow us at the England Centre for Practice Development on Twitter and Facebook. So thank you and good luck.